Hello, everyone. Our group has put together an informational presentation on the human papillomavirus vaccination, or otherwise known as HPV, and the impact it plays on our public health system. So let's start off with a background or a brief overview of the human papillomavirus, again otherwise known as HPV. HPV is a small, non-enveloped DNA virus that infects skin or mucosal cells, and the most common types are HPV 16 and 18, causing approximately 70% of all cervical cancers. Now, there are more than 200 types of HPV, with about 40 of those infecting the genital area, which includes the vulva, vagina, cervix, rectum, anus, penis, and scrotum, as well as the mouth and throat. Genital HPV infections are actually the most common. Now, an individual can get HPV by having vaginal, anal, or oral sex with a person who has the virus. And it's so common that almost all men and women get HPV at some point in their lives. Now, HPV can be passed even when an infected person has no signs or symptoms, and the majority of infections do not cause any symptoms, and most of the time it's cleared by the body's own immune system. In fact, around 70% of new infections will clear within 1 year, and 90% will clear within 2 years. As I mentioned, most genital HPV infections aren't harmful at all and go away on their own. Most people don't even know that they've ever had HPV, but some kinds of HPV can lead to genital warts or certain types of cancer. While there's no cure for HPV, there are treatment options for the problems HPV can cause. So, HPV is preventable. There are vaccines that can prevent high risk HPV types and the types that can cause genital warts. Most of the time, the body's immune system can fight off HPV before it causes any serious problems. And for the high risk types of HPV that can eventually lead to cancer, finding abnormal cell changes through regular Pap tests or HPV tests is the best way for preventing cervical cancer. HPV is clearly established as the cause of cervical cancer, and vaccines targeting oncogenic forms of the virus are important as a primary method of prevention. However, barriers to cervical screening and vaccination, such as a lack of knowledge of HPV, access to healthcare, and poor follow up, prevent the acceptance and use of HPV vaccines. Based on CDC's, all children, girls and boys who are 11 or 12 years old should receive the HPV vaccine, and the vaccination series can actually begin at age 9 years. We're going to briefly touch base on HPV associated cancer statistics. Based on the data from 2011 to 2015, about 42,700 HPV associated cancers occurred in the United States, with 24,400 of those being women. Cervical cancer is the most common HPV associated cancer among women, whereas oropharyngeal cancer is the most common HPV associated cancer among men. Now, high risk HPV cancer causes approximately 5% worldwide, and in the United States, high risk HPV causes approximately 3% of all cancer cases among women and 2% of all cancer cases among men. We just briefly discussed the statistics associated with HPV, but let's go a little bit further in depth and talk about a few other cancers that are associated with HPV. Cervical cancers. This has been mentioned quite a bit already in this presentation, but almost all cases are caused by HPV. There are two HPV types, 16 and 18, and they're responsible for about 70% of all cases. There's anal cancers, and about 95% are caused by HPV. Oropharyngeal cancers, about 70% are caused by HPV, and in the United States, more than half of cancers diagnosed in the oropharynx are due to HPV type 16. Rarer cancers, HPV causes about 65% of vaginal cancers, 50% of vulva cancers, and 35% of penile cancers. And most of these are also caused by HPV type 16. According to the CDC, at least 20 million people in the country are already infected with HPV, and approximately 6.2 million new cases of sexually transmitted HPV infections are reported each year. The current opportunistic approach to diseases associated with HPV are cervical cancer, anal cancer, and oropharyngeal cancers. So we provided this visual representation between HPV and cervical cancer as it's the most frequent cause of cancer death in women. And so as we've mentioned before, most HPV infections are harmless, but high-risk strains can cause severe abnormalities that progress to cancer. So the virus takes advantage of a transformation zone where different types of cervical cells meet in a thin junction, and immature basal cells are unusually close to the surface of the cervix. So the virus invades basal cells and then reproduces within these cells as the cells divide, mature into squamous cells, and rise to the surface. The infectious virus particles escape from the mature squamous cells and then invade more basal cells. So high-risk HPV types have the potential to lead to cancer over a decade or longer. And when the virus infects cells, it gradually causes increasingly severe damage. Public health agencies are continually working on satisfying the 10 essential public health services in regards to HPV. There is continual monitoring of HPV incidence rates as well as vaccination rates. For example, America's Health Rankings tracks factors such as HPV immunization rates in Arkansas females across time, as well as where Arkansas ranks on these factors in comparison to the U.S. as a whole. Public health services number 2 through 4 can be witnessed through a variety of community campaigns and often go hand in hand. There are several efforts taking place across the state to better understand HPV and how to best address it among the population. Through utilizing community partnerships like the health department, coupled with campus health organizations, we are able to coordinate more effective programs and work towards solving the problem altogether. Such efforts can be witnessed through events like university campaigns to educate students about HPV and encourage vaccinations and screenings. In addition to universities and public organizations researching HPV, they are also employing efforts to educate the public. Also, there are health campaigns and programs that organizations can utilize policies to help address such health concerns. For example, although the University of Central Arkansas does not require the HPV vaccination for admission, it is strongly recommended and encouraged. Let's continue talking about the last 5 of the 10 essential public health services and how public health agencies continue to satisfy these guidelines. So, number 6 is to enforce laws and regulations that protect health and ensure safety. And let's tie this into Arkansas really quick. So, Arkansas schools do not currently require the HPV vaccination as a condition for enrollment. And in fact, many schools in the United States do not require the HPV vaccination. There are, however, guidelines in place for those who should receive the vaccine. And then health agencies link people to needed personal health services. There are low cost and free options available for associated screenings like cervical cancer screening in most states. And then county health departments and women's clinics should offer these services. Additionally, Planned Parenthood can also ensure that individuals in need of services get connected with available resources. And agencies ensure there is a competent workforce by addressing issues and updating guidelines and screenings to ensure our healthcare workers are well informed on the topic of HPV. Additionally, to continue to have a competent workforce, health departments can hold in-services to educate individuals on topics like how to screen for HPV when to screen, who should be screened, etc. And the effectiveness and impact of programs like the free cervical cancer screenings can be assessed over time. By using prevalence and utilization data, organizations can potentially track relationship between trends such as an increase in HPV vaccines may lead to a decrease in cervical cancer rates. And lastly, just as the health status is always monitored, public health agencies are continually completing research on HPV. There is ongoing research for HPV, better vaccination, better prevention and treatment methods, and better programming and education. So, what are some reasons that individuals may not receive the HPV vaccination? Well, as is the case with most things in healthcare, access to care is a huge burden that can drastically impact HPV outcomes. Studies have shown that in resource poor settings, like developing countries, lack of primary physicians, screening equipment, trained laboratory personnel, and necessary expertise for screening quality assurance is extremely lacking. And this is worsened by inadequate knowledge about cervical cancer, even among healthcare workers in these countries. Studies have shown, however, that availability of screening services does not always translate into accessibility for socioeconomically marginalized and vulnerable girls and women. In our own country, for example, Indigenous and minority women experience the health effects of poverty, linguistic barriers, inadequate insurance, and insufficient knowledge of health needs and risks, lack of trust in health services, and shame regarding gynecological consultations or conversations and examination. And even if patients have access to care, screening repeats also required follow up compliance, which you can imagine is highly limited by a patient's ability to schedule time away from necessary daily tasks or travel long distances to clinics to be tested. And then women in remote rural areas are at greater risk of cervical malignancies because they have limited access to cervical screening and appropriate treatment. They also tend to be present for the first examination with late stage malignancies and comorbidities. There are potential limitations of the HPV vaccine, and one of those is public awareness. Tackling public awareness would require going after the embarrassment that surrounds STIs and the public's view of HPV immunization. Then you have parental autonomy. Mandatory HPV immunization has been labeled as a violation of parental autonomy for the prevention of a non causally transmitted infection, a misuse of taxpayers' money for a vaccine of unknown effectiveness, an unnecessary addition to an already overloaded vaccination schedule, a promotion of teenage sexual activity, and many others. And the argument in response to this is that abstinence is ineffective in protecting against STIs, secondary prevention of cervical cancer has irremediable gaps, hepatitis B virus immunizations are already mandated, and socioeconomically vulnerable women should be protected against this disease. And then there's this target audience that only women need this vaccine. So the perception of HPV immunization for girls to ensure herd immunity suggests that the disease is exclusively heterosexual transmission, but this is not true, as HPV also affects the LGBT community. And the focus of most commercials, though, is on cervical cancer without the mention of throat, anal, and penile cancer. So there is a reported prevalence of HPV types in these diseases, and anal pap smears are available, but unfortunately they're hindered by silence, homophobia, lack of awareness, fear of stigma, and even some technological gaps. So many LGBT people may not seek sexual health advice or screening due to fear of being outed and the potential consequences. Recommendations to ensure communities know about the importance of HPV vaccinations begins with programming, because proper programming leads to education within the community. This will be one of the ways to break current stereotypes and myths regarding HPV, because after all, this HPV vaccination is not only for young girls, but it's actually recommended for all children, boys and girls between the ages of 11 and 12. Clinician recommendations are also important in aiding the movement of individuals receiving their HPV vaccination. If the community has received education through proper programming and then they receive this same information from a clinician or their primary care physician that they trust, then families are more likely to be vaccinated. Ensuring the office staff is well versed in vaccinations as a whole will aid clinicians in determining when an individual is due for their HPV vaccine or really any other vaccination for that matter. As mentioned earlier, some families have inadequate access to health care, so it would be beneficial to have funding from local or state agencies to establish a liaison or liaisons for at-risk communities to explain the importance of HPV vaccines and pair these communities with the necessary resources to receive the vaccine. Trust will slowly be built between the liaison and the community, and this trust will lead to overall healthier communities. Thanks so much for listening to our presentation, and we really hope you gained some valuable knowledge regarding HPV. Should you wish to do any additional research, we have provided our references on the following two slides.